Dialysis in Puerto Vallarta. I'm at the Biomedical Centre in Mexico. And as you can see, the procedure they use in Mexico is quite different than the procedure we use here in Canada. They're very thrifty. They only use one syringe for both tube instead of throwing one syringe away and then using a different syringe for the second tube. The other item that I noticed is that um, they don't use the potato cap, so they have to remove those in order to be able to attach their line to the central line. Another item is that they have a tendency they let the blood out until the machine fills up. Once the machine fills up, then they attach the return line. At first, I didn't know what they were doing, so it was kind of, scary at first, but after a while, you kind of get used to it. The machine they use in Puerto Vallarta is relatively old from the standard. Couple of things you notice is that number one, they don't have any water filtration system, so the water is actually bucketed pretty well. And if they run out of water, the machine gets an alarm, and the nurses go run out and refill the bucket again. And that's about all they do. The other item I noticed on the machine is that the way some of the measurement they use is a little different than we're accustomed to. But again, like I said, you get used to it after a while, and and all my run that I had in Puerto Vallarta, we didn't have any issues. I did not get any infection, which is the key issue. The nurses in the Biomedical Center don't speak any English at all. The only person that speak English was the doctor, and he's not around a lot. So whenever I need to communicate with the nurses, I had to pull out my cell phone and use a Spanish to English translator. And even that is a little difficult sometimes, but I did manage to get around it of our language barrier anyway using the translator. So after the machine is set up, they wrap the tube up, and then you do your run. One reason why I found out was that the reason why they wrap everything is that they don't make any effort to sterilize the connector afterward. So that's why they keep everything wrapped up to keep any dirt or contamination onto the lines. They have one cart basically that serves the whole area, and that blue bottle you see there, that is their anti biotic spray they use for virtually everything, which is cleaning the lines, cleaning the skin for for the patches, for the bandages. They use that literally for everything. The water they use, the saline water they use, comes in a kind of a bag. I'm not sure if the bag's recyclable or not, but they only use one bag, and they hang another bag there only for emergency use. So that bag is used for pretty well everything. A couple of things you're going to notice is that they will use, they'll squeeze the water out for the flushes using the same bag as we use for the initial flushes as well. And the other item they do is that as far as getting saline syringes go, they just use an empty syringe, and they'll take the saline out of these bags. So those bags basically service almost everything, from circulation for uh, flushing, for everything, literally. Another item I know is quite interesting is that the mask that they wear, unlike us, we use it once, we toss it away. They don't. They use it for pretty well a good chunk of the full run. They don't really throw it away. I was quite surprised to see that. Even the patient, they'll have a mask on for the whole entire time that they're there. So really, they're really thrifty in that regards. So when they're ready to disconnect, they'll unwrap the paper to access the line. And right now is they'll grab an empty syringe and they'll take the saline out of the same bag for flushing. They also the heparin is put in manually and not automatically. So the heparin is injected, doing the run. They do it again, but every hour they'll inject a little bit more heparin into the system. So there you see, they used the syringe that they took the saline out of the bag, and they use the same syringe for flushing both lines. And you notice that they don't make any effort to wipe the connector before they attach a syringe to it. But again, like I said, I didn't get an infection, so which is a good part. It gets pretty scary if you're not familiar with the procedure. And again, same thing with the seal. They don't have the lock that we use. They basically add heparin to water, the saline, and then they inject it into the line, and that's their lock. Now that little wipe that you see there is the wipe that I gave them to clean the connector before we put on the dado cap to protect my line. If I didn't give them those little connectors, they would have just wrapped that up and they would have been finished with their lines. So I didn't feel comfortable them putting dado cap onto the line while cleaning the line first. So I did give them some of the cleaner. And again, I didn't bring a lot of supplies with me, so I was a little concerned I didn't have enough for the whole entire time I was there. So that's something that I've learned, is that next time I go to any of these dialysis center, bring your own supply and make sure you have enough for the whole entire time and maybe extra. And you see that spray bottle they use, and that basically is what they use to clean the skin, clean the line, clean everything. They also put my line in backward where the thing was twisted. When I got back to Calgary, I had to untwist it again and set the connector straight. Well, I didn't notice it until I got back because I didn't do this work, and they don't have any mirror to see what I was doing. And by the time they're done, everything was covered, so I couldn't tell. So I got a little bit of red around my exit wound. I took some antibiotic and I, got to put some cream around it during the entire time I was there, and that kind of kept potential infection from coming in. But it was pretty red when I first got there, and I think it was part of the cause for the fact that the humidity in Puerto Vallarta is quite high, and I was taking quite a few showers, so that may have gotten it wet, and that may have caused the irritation. I don't think it was an infection. I think it's more of an irritation than an infection. So that's what I was hoping anyway. But anyway, like I said, we did put the antibiotic cream around the exit room. I did take some antibiotic, and by the time I got back, the nurse checked it out and everything seemed to be fine. And this is a situation where I had to remind the nurse that the doctor requested they put these cream on it, the antibiotic cream, before they put the bandage on it. So again, the nurses, that's not their normal procedure. So if you don't tell them, they just do what they normally do. And normally they would leave that bandage like that, or they may put another bigger bandage over it, which is a kind of a cloth bandage. I made a request to put a waterproof bandage over on top of it, so that if I take a shower, it wouldn't get wet. So these are the bandage I had them put on top of it. Now again, this is not a normal procedure for them. So, but if you don't ask, they'll just use their normal, cloth bandage, which a little bit of wet will cause it to disintegrate literally. Overall, I thought my trip to Puerto Vallarta was quite enjoyable. At first, it was a little scary, but once you get used to it, everything was fine. I will probably go back again later on this year, but I would probably go to the other clinic, which is Puerto Vallarta, which has a newer clinic.